Hi everyone, welcome to the Fight Colorectal Cancer webinar. Today we will be discussing coping after a colorectal cancer diagnosis. And for today's webinar, if you have any questions during the presentation, please feel free to ask your question in the panel on the side of your screen. We will be able to address your questions during the presentation and also after the session. The webinar is going to be recorded, and following the end of today's webinar, we will be posting the recording and the slides on the Fight CRC website. You can find those by visiting fightcrc.org. And if you are on Twitter, please follow us along using the hashtag CRCwebinar. Fight Colorectal Cancer offers a wide variety of resources for those touched by colorectal cancer. Visit our website to view, download, and order the latest resources. The information and services provided by Fight CRC are for general informational purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnoses, or treatment. If you are ill or suspect that you are ill, please see a doctor immediately. In an emergency, call 911 or go to the nearest emergency room. Fight CRC never recommends or endorses any specific physicians, products, or treatments for any condition. And with that, I'd like to introduce today's presenter, Eden Stotsky-Himelfarb. Sorry if I just pronounced your last name incorrectly, Eden, but she is amazing. She's an oncology nurse navigator at Johns Hopkins. She's done so much to support patients and their family members really adjust to their diagnosis and go through treatment. She started working at Johns Hopkins since 1995, beginning in human resources, where she became familiar with employee benefits, and she continued to work full-time after she herself was diagnosed with cancer in 1997. Her cancer journey inspired her to become an oncology patient navigator, and again, where she supports patients and their loved ones who are experiencing colorectal cancer. In 2009, she earned her nursing degree and worked in a variety of outpatient oncology settings, focusing on GI cancers, including colorectal, liver, pancreas, biliary, and abdominal sarcomas. Through her work, Eden has improved the outpatient oncology experience by providing evidence-based practices and education and resources, addressing common issues related to surgery, chemo, and radiation, and of course, answering all patients' questions. She is the patient advocate on the National Comprehensive Cancer Network Colon Rectal Anal Cancer Panel and serves on the NCCN Colorectal Cancer Quality Measures Subcommittee. She's authored a chapter in the American Cancer Society's Complete Guide to Colorectal Cancer entitled Taking Care of Practical Matters, Work Insurance and Money. Eden earned her Bachelor of Science degree from Johns Hopkins School of Nursing in 2009. So Eden, thank you so much for being here today. And I'm gonna hand over the controllers to you so you can scroll through your slides at your own time.
Okay, very good. Thank you so much, Sharon. While I am pulling up my slides, can you all see?
Yes, we can.
Slides, you can see the slides. Great. Okay. Okay, wonderful. All right. So here we go. Thank you again, Sharon, for the introduction. Sometimes when I hear that introduction, I think, wow, all of that. And it sometimes, as we were discussing before the webinar officially started, it does sometimes seem like a lifetime ago when I was actually diagnosed with colorectal cancer. So again, I am a stage 3 colorectal cancer survivor. I did have surgery, chemotherapy, and radiation back in 1997 and 1998 and have been NED ever since, getting that wonderful colonoscopy every year and blood work and just staying on top of on how I feel and listening to my body. So today we're going to go through several topics listed here on the screen. First, we're going to talk a little bit about understanding your diagnosis, talk about side effect management, shared decision making, managing mental health, talking to family, talking to colleagues, and limiting cancer's place in your life. So before I get into the meat of all of this, I just want to share with you that currently I'm working as a nurse navigator with a program called WorkStride. And what we do is, or what I do is I help employees all over the country who are trying to work while they're going through cancer treatment. So at the end of this presentation, you're going to see my contact information, and I encourage you to please reach out if you have any questions about working with cancer, or taking a break from working while going through cancer treatment, or just any questions in general about the whole idea of going back to work after a cancer diagnosis, or anything related to employment. So I'm going to start off talking about understanding your diagnosis, and this is pretty basic. So what is colorectal cancer? So cancer, we know, is a disease in which abnormal cells divide uncontrollably and destroy body tissues. So it's typically diagnosed either through a routine colonoscopy or an incidental finding on a CT scan when you've had pneumonia, or you had a broken bone and you had some kind of imaging done and something was seen, or if you presented with symptoms and then of course had a workup after that and was diagnosed with colorectal cancer. So there are different stages of colorectal cancer, 0 through 4, and each stage has its own tumor node and metastases designation. So if anyone has any questions about that, I'm happy to answer them. Also happy to answer them offline, and certainly a piece of your diagnosis that should be well understood from the beginning is what your staging is. As far as how to cope, I know that's the title of this presentation and we could spend days talking about it. I'm going to get into the meat of how do you cope in a few slides. But first, I want to talk about a couple of other things. And making treatment decisions is also another topic we're going to cover, and I'll get to that in just a moment. So I'm going to start off with side effect management. And this is what I encourage all of my patients that I work with, is that the key to side effect management is communication with your healthcare team. And that really is the key to your entire cancer care continuum, is communication with your healthcare team. Something as simple as, who do I email when I have a question? What number do I call when I have a question? Who do I call after hours is always so big. I talk to employees and I talk to patients and they say, well, I didn't feel well over the weekend, so I went to the emergency room, and I think to myself, well, you could have avoided that ER visit potentially if you just knew who to call. Well, how do I know who to call? I didn't know who to call after hours. Something as simple as knowing who to call and when to call them, or knowing who to email at what point, it can really make your cancer journey so much easier. And sometimes it could be a social worker if it's some kind of an emotional or a psychological challenge that you're having. That may be your social worker. It could be your navigator. It could be your nurse. It depends on how each team is set up, but it's so important to know how to communicate with your healthcare team, not just knowing how to talk to them, but also how to actually get in touch with them. And from the beginning of my career in healthcare, I've always said that side effect management is not just your physical side effects, it's also your emotional and mental side effects. So if one day you're feeling sad, you're feeling lonely, you're feeling particularly anxious, these are all side effects that can be managed by your healthcare team. So we talked a little bit about shared decision making, and that does come into play when we talk about making treatment decisions. So you will find sometimes in your cancer journey that you're at a point of decision making. What to do next? What treatment to have next? What avenue should you take? And that process the overarching idea should be that it's shared decision making. So it's a key component of what we call patient-centered healthcare. And it's a process in which clinicians and you as the patient and your loved ones, your caregivers, your family members, your friends, whoever you have as part of your caregiving team, work together to make decisions and select tests, treatments, and care plans based on clinical evidence that balances the risks and expected outcomes of the actual treatment with the patient preferences and values. And quality of life also plays a factor in this shared decision-making process. One thing that I want to share with everyone on the webinar is, I know from my personal experience of having been diagnosed with cancer and also being a caregiver to both of my parents who had cancer, that sometimes, or maybe all the time for some people, we look at our healthcare team and we expect them to have definitive answers at every turn. And sometimes those answers aren't as definitive as we would like them to be. And part of that is your healthcare provider trying to make it a shared decision-making process, patient-centered healthcare, where we don't make the decision. We, as a healthcare professional, we don't make the decision for you. We help you make that decision, and we guide you, and we give you the best information we can to help you make that decision. I always say knowledge is power, and from a patient's perspective, sometimes that can be overwhelming because you have all this knowledge and you're not sure how to exercise your power or to make that decision, but that's what your healthcare team is there to help you do, make that decision when you may be at a crossroads with treatment. So the next topic I want to cover is managing mental health, and that is it's a big topic, and again, we're hearing a lot about it in the media these days, and I've always been a proponent of not only dealing with physical health but mental health, and mental health encompasses emotional well-being, psychological well-being, and social well-being. And these aspects of a person's well-being can be affected after a cancer diagnosis, as many of you on this webinar are probably familiar with. They can also be affected during treatment. They can be affected when you're living life after cancer or just living with cancer if you have metastatic disease that you're living with as a chronic illness. And it's important to remember that your healthcare team is there to treat the whole person. At least that's what we like to think, that they're there to treat the whole person, including not just your physical, but your mental health concerns. So feelings like stress, anxiety, fatigue are very common, and discussing these feelings with your healthcare team when they come up can strengthen not only your emotional well-being, but can also provide you with an enormous sense of relief when you're dealing with some of the other physical aspects. And I know that mental health is something that a lot of people don't want to talk about, but if you, I always try to remind my patients that if you had a broken leg, you wouldn't ignore it. And so try and think of anxiety, depression, sadness, fear as a broken leg. Don't ignore it. You got, if you can pay attention to it and treat it and deal with it, it's going to be that much easier moving forward. So what mental health concerns can come up after a cancer diagnosis? I mentioned a lot of these already: sadness, anxiety, worry, fear, even post-traumatic stress after a diagnosis. All of these are very common after a cancer diagnosis. It's important to pay attention to intense bouts of sadness because that can lead to depression. A certain amount of anxiety or worry is natural. Most of us do that on a regular basis, and a small amount of it is really a natural experience, but it can intensify after a cancer diagnosis. And also chronic anxiety can lead to depression. It can also lead to extreme tiredness over time. Fear is also one of the many complex emotions that can arise after a cancer diagnosis. The fear of what's coming next, the fear of recurrence can also happen if you have been declared no evidence of disease. You can have that fear of recurrence, or the fear of what the treatment is going to bring, the fear of what side effects are going to happen from the treatment. Those are all common feelings. And post-traumatic stress can be a response to a life-changing event, like a cancer diagnosis. They say that there are 7 major life events that can cause stress, and illness is one of them. And of course, cancer is an illness. And this can also be for your family members as well, and for caregivers. So I always try to incorporate them because they're there when a patient is diagnosed with cancer. Really, it's their whole inner circle, their whole family that is diagnosed. So how can your healthcare team help? Again, I go back to the idea of communication. So it's important to provide your healthcare team with a complete and thorough medical history, so they know exactly what your history looks like. If any of the feelings of sadness or anxiety or fear comes up, make sure to tell your healthcare team so they can talk to you, they can refer you to a counselor. If need be, perhaps even a psychological evaluation would be necessary. And this is all part of the concept of treating the whole person. So not just the physical aspects of cancer, the side effects of treatment, but also the emotional distress that can come along with a cancer diagnosis. And of course, it's important if you're already seeing a social worker, or you're seeing if you're seeing a therapist, that it's important that they communicate with your healthcare team as well. And oftentimes they'll ask you to sign a release to be able to communicate with your healthcare team if you're working with an outside counselor, and that is so important. So again, there can be this patient-centered, multidisciplinary care. And then, of course, if you're already on any medications to deal with any anxiety or fear or depression, make sure that your oncology team is aware of that, so they can potentially think about any drug interactions if that's something that needs to be addressed. So how can someone living with cancer help themselves? These are some ways. There are many ways, and I'm, again, happy to talk offline with anyone afterwards about any specific ways that someone living with cancer can help themselves. Again, take note of shifts in your mood, or your change in your appetite, or any changes that make it difficult to accomplish your daily tasks. Listen to your caregivers, your loved ones, if they notice a change. Sometimes they may see changes that you may not. And of course, speak to your healthcare team if any of these changes occur. Cognitive behavioral therapy is one form of counseling, and it can help you manage your feelings and challenge some of those negative thoughts that keep running through your mind, and replace them with more helpful, positive ones. Simple breathing exercises. You'd be surprised how a simple breathing exercise can help you just manage your mental health, and how it can actually make you feel better. And there's some very easy, even 4-step breathing exercises that I would be happy to share with you that are helpful, that would help you just manage that mental health. And you could do that 5 times a day if you wanted to. And then, of course, and I've mentioned this before, seek support. So if you feel like talking to a counselor would be helpful, or talking to a therapist would be helpful, then reach out and try and make that happen. And again, I know when you've been diagnosed with cancer, there's so many appointments and so many obligations that you need to address, and you may also be working and taking care of your family and children, and so the idea of going to a therapist may be just overwhelming. But really, the truth is that going to a therapist could take away some of those feelings of being overwhelmed. And I know that from experience in talking to some patients, that finding a therapist can sometimes be very, very challenging. Either they don't take your insurance, they may be too expensive, they don't return your call, you may not click with them the first time you see them. And so it will take some effort to find a good therapist, but I can promise you that if and when you do find that good therapist, that it will be helpful in managing your mental health. So the next topic I'd like to discuss is talking to family, and this can really be challenging. Of course, what I'm about to say does not take into consideration the different dynamics that exist in families. I know firsthand that there are some, dynamics exist in every family, and for those of us that say that they don't, we need to look a little bit closer, because different dynamics exist in all families. So it really does depend on who you're talking to as to what you would say to them. So young children, for example, need very basic information. Don't ever assume that young children don't know that something is going on. We oftentimes assume that, but believe it or not, they're pretty smart. And your young child may see you potentially crying or you know, putting on a wig, for example, and they don't, the way that they express their stress and concern is by acting out, by not sleeping, by not eating, being very clingy. So letting them know in an age appropriate way that you're working to get healthy, whatever that may look like, is the goal. And so again, we oftentimes assume that they don't notice, but they can be very smart, but they just don't have the ability to express themselves oftentimes, or most times, at least not verbally. So elementary school children, it's a little bit of a different level, because they actually worry that that you may die, because they're starting to understand the concept of death. And it can be a concern, especially if they remember about a classmate or other family who has passed away from cancer in the past. Be sure to inform teachers, school counselors, coaches, anyone that comes into contact with them a lot, what's going on in the family. And again, you don't need to disclose details, but you can just say that there is a medical issue going on. And I'll get more into that in a few minutes. But letting your children's other caregivers know is important. And again, you can tell them you're doing what you hope, you're doing as much as you can to get healthy, and that you want your lives to go on as normal as possible, and that you may be asking friends and family members to take care of them, but that is going to maybe a normal part of their lives moving forward. And sometimes they may want to make cards for you or make arts and crafts projects for you. And again, that is highly encouraged. One just sort of other thought is about hair loss, and sometimes children like to be involved if you plan on cutting your hair or shaving your head before losing any hair, which many times is not common with treatment for colorectal cancer. But if you notice it's getting thin and you decide you want to cut it, you could have them come with you to get their hair cut, and you can get your hair cut as well. So and just, you know, reminding them that this is happening to you and not to them, and comforting them in any way that they can, and you'd be surprised how much they're going to comfort you back. Teens are a special challenge from my experience. Boys can sometimes become overly quiet and avoid sharing their emotions, whereas girls can become very emotional and outwardly worried. And again, may be concerned that you're not going to survive the illness. And in some cases, that is a real concern, and they are old enough to understand that. You also want to remember that the older they get, you may feel like you want to treat them as an adult because they're getting older, but be cautious in doing that. It's fine for them to help with things and to be a part of the process, but you don't want them to obviously miss out on being teenagers in as much as you can manage that. So normalcy is important for everyone, including your kids. Reward them for pitching in when they do, and also make sure that their caregivers, teachers, coaches, etc., are aware of what's going on. Again, you don't need to disclose any specific diagnoses, but at least that there's a medical situation that's going on. If you want to disclose, absolutely, you can. That's totally in your in your power. Parents may be overwhelmed when one of their adult children is diagnosed with cancer. Personally, I know when I was diagnosed when I was 26, my parents were extremely overwhelmed. My father went into to-do mode, and my mother went into fear mode. And it was a pretty stark contrast between the two of them, but I was aware of how they were handling it. And it was definitely difficult. And it can be difficult depending on whether an adult child is living with you or not living with you. The feelings of no control or wanting to control if they're living at home. Again, keeping parents informed to the degree that that you feel is necessary and comfortable. If they live nearby and you have children, then give them concrete things to do, like cooking, babysitting, going to run errands for you, things that they can, you know, very, very concrete. Because for parents to see a child ill is very difficult. So, and also if you do have kids, remind them to be as upbeat and positive as they possibly can, and to try and share their concerns with you and perhaps maybe not with your children. Your spouse or your partner, the one that could potentially be the closest to you, could be the most affected by your diagnosis. I often say that sometimes the cancer journey can be harder on the caregiver than on the patient, and I've worn both hats. So I sort of speak from experience with that. Your partner is going to be trying to learn this new role of a caregiver, and they want to know what they can do to help, how they can help. And sometimes you as the patient don't know exactly what they can do or how they can do it. You'll want them to accompany you to doctor's visits where major decisions are being made, ones where you really do need an extra set of ears. That is crucial and will be super helpful at those decision-making appointments. Your spouse may also be kind of like the 411 person that has all the information, that keeps the notebook. And again, it doesn't have to be a spouse. It can be a best friend, a partner, a loved one, the person that's closest to you through all of this. They may be the one that looks up the information and handles the email communications and makes the phone calls, organizes people that want to help. They may do all of that, or that may be something that you as the patient want to hold on to because that is something you can control. And when you have a cancer diagnosis, you tend to have that feeling of loss of control. And so if you can have something that you can control, like doing all of these errands, then that may be something you may want to hold on to. Also understanding that in a partnership, sometimes one person expresses more feelings than the other. You should know, you as partners should know what to expect from one another. However, a cancer diagnosis can change that landscape. So it's important for you as the patient and for your loved one to have others to be able to talk to. Could be a best friend, a close family member, someone who will lend an ear. I know that that's not always easy, but it is something that that you should try and identify, kind of that safe person outside of the partnership that you can talk to. And if you don't have a spouse or a partner, identify those safe people that you can go to talk to, that will be there for you no matter what, that know you, that understand you, and that will be able to help you and support you through this journey. So the next topic is talking to colleagues. This is a topic that's near and dear to my heart and in the work that I'm doing now. Most of the time, employees feel like they need to disclose their diagnosis to their managers and to their coworkers, and that's actually not the case. You are not legally obligated to share the actual diagnosis with your manager or your coworkers. And actually, you're not legally obligated or obligated at all to share anything with coworkers. With your manager, if you're going to be out of work, you do need to let them know, and it is appropriate to let them know that it's because of a medical situation. You don't need to disclose your actual diagnosis to them. So just please keep that in mind. I've come across some situations where managers don't know about this as well, and they either feel the need to ask when it's not appropriate, or when they have the information, they share it when it's not appropriate. So just remember that you as a patient, if you're also an employee, if you're working, that you have rights, and that you have rights as an employee in the workplace. And so that doesn't just include FMLA, which is to protect your job, but that is also having to do with disclosure and how much you disclose and whether or not you do disclose. one thing I want to mention in going back to talking to your colleagues is that sometimes you're undergoing treatment that it's hard to go through the treatment without those around you becoming aware of your situation. It could be stressful to try and hide the side effects. But just keep in mind that what you say about your situation, who you tell, is totally within your control, and you should expect confidentiality at all steps. And it's perfectly fine to say, I would prefer not to discuss my personal health at work if you feel someone is becoming too invasive or asking too many questions, or if you choose to share, it's perfectly okay to ask them to also keep it confidential. Hopefully in the workplace, you'll find that if you disclose your situation, the coworkers and supervisors will want to do everything they can to help, bring meals, take help with your workload, work overtime so you don't have to do that. And certainly you can accept these offers, or you can certainly reassure your coworkers you have everything under control, you appreciate their kindness and generosity, and you don't need it right now, but if and when you do, you will let them know. So it's a tough situation sometimes, because many of us spend more time at work than we spend anywhere else, and so it is another whole maze that needs to be navigated. And just keep in mind, you do have rights, and you should have resources within your human resources department, your benefits department, hopefully your supervisor, to be able to navigate that piece of the journey. So I'm coming to the end of my presentation here. We're going to have some time for some questions, but one thing I want to share with you is this last slide, and it comes from a concept that my boss, Lily Shockney, who is very prominent in the breast cancer community, has come up with, and that is limiting cancer's place in your life. When you hear the words that you have cancer, or someone you love has cancer, the whole world certainly seems to stop. At least I know I felt that way, and I know others feel that way. Your life can easily become monopolized with the disease and thinking about it all the time, reacting to it. You can become immobilized with fear. But it's important to remember that in some cases, many cancers are curable. Many cancers are also being treated. Many colorectal cancers are curable. Many colorectal cancers are being treated as a chronic illness. And that you don't want to give cancer any more time or energy than it deserves. Getting a cancer diagnosis can be sobering. It can certainly trigger some self-reflection about your personal well-being, your family, your professional, your spiritual well-being while you're undergoing treatment. But you should try and normalize your life as much as possible. Keeping to your routine for your sake and for your family members will help with what can be a very scary situation. Again, don't be afraid to ask friends and family to devote some of their time and energy to helping you through this diagnosis, but certainly not, don't give cancer any more time than it deserves, if that's at all possible. If you can continue to work and do things that you enjoy, whether it be yoga or fishing or birding or whatever brings you joy, you don't want to stop doing those things, because certainly cancer does not deserve all of your time and energy. It already takes a lot to go through the treatment, and we don't want to give it any more time than it deserves. So with that, I will wrap up. I'm happy to take questions. We have plenty of time for questions, and I'm happy to take those questions. This is my contact information, my email address. Feel free to email me at any time with any questions related to this presentation or any other questions. And then that's my direct phone number down at the bottom of the screen there. And I'll leave that up while we go through questions if I can.
Sure. Thanks so much, Eden. That was a wonderful presentation.
Sure.
So we do have a couple questions. The first one is, aside from the oncologist, surgeon, or radiologist, what other healthcare providers should a person seek to have on their healthcare team at the time of diagnosis?
Oh, that's a great question. I'm so glad you asked. So, of course, what was mentioned, so the surgeon, the surgical oncologist, medical oncologist, and radiation oncologist. Please keep in mind that most of these medical doctors have what we call mid-level providers that work with them. So nurses, registered nurses, nurse practitioners, physician assistants, and they're oftentimes easier to get in touch with than the actual medical doctor. So you want to make sure that you know who those mid-level or advanced practice providers are. Also, believe it or not, the secretary in the doctor's office is on your team too, because they're the one that may be answering the questions or scheduling procedures. So they're a part of your team. If you have access, like I said, to mental health providers, nutritionists, depending on whether you're looking for acupuncture or massage, all of those ancillary services can be a part of your medical team. Oftentimes, pathologists and radiologists, they're not typically the ones that interface with the patients, but sometimes they do. Sometimes they do, and it certainly is a reasonable question when you have a scan done. Can I talk to the radiologist? Is the radiologist someone that I have access to? Certainly that is another person. Then, of course, if you have a therapist, and when I say a therapist, that could be therapist, counselor, social worker, psychiatrist, psychologist, anyone that is in the mental health field, they should absolutely also be on your team. And then if there's a navigator, many hospitals now have nurse navigators or patient navigators that are a big part of the medical team that can help navigate some complicated situations. There also may be a financial counselor in your institution, depending on where you're going and what your situation is. So financial counselor could be someone that's also on your team. And when I say secretary, that could be anyone that does scheduling. So it could be the scheduler that is also on your team. But cast a wide net, because you want as many resources and as much assistance along this journey as you can get.
Thank you. That was awesome.
Sure.
So let's see, we have some more questions that came in. Okay, so after a diagnosis, how do you not feel rushed when you're trying to make your treatment decisions?
Well, that's a great question, actually. How do you not feel rushed? So it's a question of, are you rushing yourself, or do you feel the medical team is rushing you? And in either situation, you as the patient have rights to put on the brakes, push the pause button and say, I need a day, I need 3 days, I need a week, I need to talk to my brother's sister, I need to talk to, that didn't make sense, my brother's wife, I need to talk to, I need to talk to my friend who's a physician. You have that right. I think that, even though we're working so hard to make cancer not be a scary diagnosis, I think sometimes it still is, and people do feel rushed to make the decisions. But remember, this is a life event, and you want to take each step as you can and not rush into doing it. So again, if you're feeling rushed, you have that right as a patient to slow down. And if your medical team is rushing you, then you have that right to tell them to slow you down. And the other piece is, some might say, if you've got a medical team that's rushing you, not respecting the fact that you want to slow down, maybe you need to find another medical team.
Thank you. That's a really great point. Finding a new medical team if you're uncomfortable or not getting, your input in, or if you're feeling rushed. It's a really great point.
Yeah.
What role do patient navigators play? Are patient navigators or care coordination teams always available?
So the first question was, what role do navigators play? Was that the
Yes.
Okay, so it depends on your institution and where you're being treated, your cancer center, whether it's regional, whether it's a comprehensive cancer center. Many cancer centers have nurse navigators these days. Many cancer centers even have colorectal cancer nurse navigators. Some have GI nurse navigators, whereas they cover all GI cancers, so pancreas, liver, colorectal, biliary, the whole gamut. So it just depends whether or not your institution has those navigators, and if they do, then you should by the fact that you're a patient at that center, at that institution, you should have access to those navigators. Typically, navigators are available to everyone. If somehow, some way, there isn't a navigator at your institution, there's an organization called the Academy of Oncology Patient and Nurse Navigators, and you can look on that website to see if there's a navigator in the area that you may be able to call, in your area that you may be able to call. May not necessarily be at your institution, but some of them are more than willing to work with patients who aren't being treated at their home institution. Did that answer the second question, Sharon?
I think so. Yeah. Yes. Thank you.
Okay. Yep.
Again, as a reminder to folks that are listening on the line, if you do have any questions that come up, please type them into the Q&A box on your screen. And let's see if we have any more questions that have come in here. Okay, we have one more question. How can medical care teams integrate and promote mental health at the time of diagnosis? So I guess that's—
I'm sorry, can you repeat that one more time?
Yeah, so it looks like this is more a question for healthcare teams, and
Yep.
and they're asking, how can medical care teams integrate and promote mental health at the time of diagnosis?
Yeah, that's a great question, and I think that's an issue that's at the forefront of medicine in this country right now. I think that what medical care teams can do, there is a distress screening that can be done. It's through the National Comprehensive Cancer Network, and that distress screening can be given to a patient to complete. And if they determine that the patient is in distress, of course, it's self-report. They determine that the patient's in distress, they can act appropriately, whether that means acute or acute attention or referral to a provider. That would be probably my first suggestion. And if you don't want to do the distress screening, simply asking the patient, are you sad? Are you scared? Do you feel anxious? Are you fearful? And if they answer yes to any of those questions, ask them if they would like to meet with a mental health professional and try and identify who that might be. Some cancer centers have oncology social workers that can be a liaison between the patient and a more long-term provider, a therapist that could be a long-term provider. Some themselves actually provide therapy on a short-term basis until the patient is feeling like they can handle the feelings that they're having. But I absolutely think it's a conversation that needs to happen soon, early on, at the beginning of a diagnosis, and it shouldn't be shied away from. It should be dealt with just like the cancer diagnosis. Just deal with it head on. So I hope that answered the question.
Yes, thank you. And it looks like we have one final question. After colorectal cancer diagnosis, is there anything in particular that I should have at my home? So I think they're wondering, like, should I go to the store and buy anything, or is there anything that is like really helpful, maybe like a planner? What types of like tangible items might be useful?
Yeah, that's great. Great question. So I would say absolutely. And I always tell patients to get a notebook and document everything, potentially a notebook that has a folder in it that they can put in any of their paperwork. And that just becomes kind of something that goes with them to all of their appointments so they can document what happened and when. A water bottle is always advisable so you can stay hydrated, and that is whether it's before surgery or after surgery or radiation or chemotherapy. Hydration is always super important. Depending on what side effects you have, you may just want some kind of a bag, like with a zipper on it, that you carry medications that treat side effects, like anti-nausea medications, or if you've got sores in your mouth, some of the wash to rinse your mouth with, or lotion if you get the syndrome on your hand. You know, those may be things that you want to carry with you. So you may want to have a backpack. Backpack is typically, you know, everyone is comfortable carrying a backpack. It's best for your walking. And then it depends, you know, if you're going to have radiation, if you're going to have chemotherapy, if you're going to have surgery, what does that recovery look like? What do you need at home? For that, I would say on your refrigerator, just a general list of phone numbers of who to call for your surgeon, your radiation oncologist, your medical oncologist, any after-hour numbers, just in case somebody comes over, you're not feeling well. You can say to them, hey, go into the kitchen. The phone numbers are all, you know, on the cabinet or on the refrigerator, wherever you would like to put that. One thing I haven't talked about at all during this presentation, which I was remiss in leaving out, is planning for the future. And this is something that should be done by all of us. It doesn't mean that your end of life is nearing. It potentially could be, but it doesn't have to mean that. But planning for your future, so having a will in place, a healthcare agent, advance directives, living will, the same thing, power of attorney, making sure that all of those things are in place. And again, those things should be in place. We should all have those in place, regardless of our health, regardless of our age. And so the reason I bring that up is sometimes if you are, if you're DNR or DNI, that notification does go on your refrigerator. If God forbid 911 is called, and they know that that's where they go to look to see if a particular person in the house is either DNR or DNI. So it's, you know, again, not something that we all want to talk about, but it's so much easier. You feel so much better once it's done. And again, that should be something that we all have in place, regardless of our health status, regardless of how old we are. That's important to have. So I hope that answered the question. Also, certain foods. So if you find that you're craving, I know when I was going through chemotherapy, it was odd. I would crave tuna salad all the time, tuna salad. It was the strangest thing. And so I always had to make sure that I had tuna salad in the house, because oftentimes that was the only thing I wanted to eat, breakfast, lunch, and dinner. So if that's something that you know that you want vegetable soup because that's what you want and that's what you're craving, or let's say you want a piece of chocolate, if that is something that you crave, then you'll want to make sure to have those things in your house. So at 11 o'clock at night, if you're hungry, you're not needing to go to the grocery store or running, you know, sending your loved one to the grocery store. Although these days there's all sorts of delivery systems that you can utilize and get pretty much anything you want at any time, but my mindset isn't quite there yet. So I always say, be prepared and have those things in your house as you can.
Well, thank you so much, Eden. What a great presentation. Awesome discussion in the start of Colorectal Cancer Awareness Month.
Yeah.
And for all those who listen, thank you so much for joining us. And thank you again, Eden. Do you have any final comments or anything for the listeners?
I would just say that, you know, stay strong and just remember not to give cancer any more time than it deserves. And if you have any questions or concerns, again, my information is on the screen. I'm happy to be contacted directly and happy to help in any way that I can. And of course, if anyone needs anything at Johns Hopkins, or if you're looking to come here for treatment, certainly let me know and I'm happy to help with that, or even meet up with you and say a quick hello and give you a big hug and say things hopefully will all be okay. And just, you know, we have to also be thankful that we have organizations like Fight Colorectal Cancer to help us along this somewhat complicated journey at times. So thank you.
Thank you, everyone. Have a great day.
Bye-bye.